Any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is the control of the healthcare professional, patient, or consumer. Such event may be related to professional practice, healthcare products, procedures, and systems including prescribing, order communication, product labeling, packaging, and nomenclature, composing, dispensing, distribution, administration, education, monitoring, and use. For actual error, medication error conjured and reaches the patient. The second one is the error is detected by the patient. It is considered as actual error. For near miss, medication error that has the potential to cause an adverse event, patient harm, but did not reach the patient because of change or because it is intercepted in the medication use process. If the healthcare personnel detected and corrected the error before it reaches the patient, it is considered as near miss. Medication error may be committed by both inexperienced and experienced personnel like doctor, pharmacists, dentists, and other healthcare provider, patient, manufacturers, caregiver, and other. All medication errors involving any medicine used both in public and private sector should be reported.
Medication error classification. Category A, B, and C. Brief importance of medication error classification, ensuring patient safety. Category A, no error. B, error no harm. Error harm, error severe harm. Category A, non-error. No medication error, for example, properly administered medication. Category B, error non-harm. Error addition, no harm to the patient. Control wrong dose in time. Category C, error harm. Error causes harm, adverse effect due to medication error. Category D, error severe harm. Error result in severe harm. For example, seriously complication, including severe intervention, important for reporting, encouraging reporting of continuing importing, building a culture of openness. Case study, real-world example of insulation, reason, learn and important. Prevention strategy. Strategy for each error category exhibits MCBLC system approved. Continue improve. The incentive nature of ensuring active practical collaboration effort of any important. Summary of the key points. Commitment to patient safety. That's all for me. Thank you.
Classifications. Category E. An error occurred that may have contributed to or resulted in temporary harm to the patient and required intervention. Category F. An error occurred that may have contributed to or resulted in temporary harm to the patient and required initial or prolonged hospitalization. Category G. An error occurred that may have contributed to or resulted in permanent patient harm. Category H. An error occurred that required intervention necessary to sustain life. Category I. An error occurred that may contributed to or resulted in the patient's death.
Types of medication error. First, prescribing error. Incorrect drug product selection based on indication, contraindication, known allergies, existing drug therapy, and other factors. Eligible prescription of medication order that lead to the error that reached to the patient. Second, omission error. failure to administer or prescribe a drug product to the patient. The failure to administer an ordered dose exclude patient refusal and clinical decision or others. Next, dose error, dispensing or administration to the patient of a dose that is greater than or less than the amount ordered by the prescriber. Next, route of administration error, use of wrong route of administration of the correct drug.
Type of medication error, wrong time error, administration of medication outside a predefined time interval from its scheduled administration time. Unauthorized drug error, dispensing or administration to the patient of medication not authorized by a legitimate prescriber. Dosage form error, dispensing or administration to the patient of drug product in a different dosage form than that ordered by the prescriber. Drug preparation error, drug product incorrectly formulated or manipulated before administration.
Administration technique error, inappropriate procedure or improper technique in the administration of drug other than the wrong route. Deteriorated drug error, dispensing or administration of a drug that has expired or for which the physical or chemical dosage from integrity has been compromised. Monitoring error, failure to review a prescribed regimen for appropriateness and detection of problem or failures to use appropriate clinical or laboratory data for adequate assessment of patient response to prescribed therapy. Compliance error, inappropriate patient behavior regarding adherence to a prescribed medication regimen.
Today, I will talk about root cause analysis, or known as RCA. Root cause analysis, or RCA, is method that used to pinpoint the exact cause of a problem or event resulting from breakdown in process and system. The root cause is the actual cause of a specific problem or set of problem, and when that cause is removed, it prevents the undesirable effect from occurring. The root cause is the actual cause of a specific problem or set of problem, and when that cause is removed, it prevents the undesirable effect from occurring. Usually, to recognize the RCA or root cause analysis, the pharmacy use CHIS model to compare level of defense to any active error. To recognize the RCA or root cause analysis, pharmacists use Swiss CHIS model to recognize active error in 4 types of level of defense. Next, I will talk about why medication error happen. In first level of defense, it happen because patient allergy history is not obtained. Medication error happen in second defense because prescriber write order for medication to which patient is allergic. If the ME or medication error go to stage 3 or defense number 3 or third defense, it because pharmacy failed to check patient allergy status. If the nurse give patient a drug to which he or she allergic, it means it is the last of the stage of defense stage. If this ME or medication error happen in long period, it can cause death to the patient. Next, I will talk about RCA tools. These RCA tools used to recognize the ME or medication error. There are 5 why the method they use in pharmacies. Why number 1 happen because wrongly prepared drug not checked before dispensing. Why number 2, drug wrongly taken has multiple strength with similar shape and different color. Number 3, staff preparing was a new staff or 1 week in training, inexperienced personnel or staff. Why number 4, is about environment, like peak hour dispensing. Point number 5 is about new staff not monitor or insufficient staff. Solution for this, why or this ME or problem for medication error is staff in training should complete the training before walking on floor. Besides that, policy on new staff must be communicated and followed through. To end my sharing, I will talk about ME report or medication error report. Medication error report happen usually because individual factor it's because a new staff. Second, ME usually happen is task factor, procedure and guidance. It's happen because double checking not done. Medication error in environment happen because peak hour or insufficient staff. To solve the problem or ME medication that I said just now, for individual factor, new staff must complete training and orientation. Second, task factor, procedure and guideline. To solve this problem, pharmacy usually make reminder poster or reinforce 5R. For the work environment, manpower planning for peak hour, deploy staff from other depth. Thank you. That's all from me.
Next is I'm gonna present about avoid dispensing error. Usually, caused by prescribing error is use of error pre-abbreviation, trailing zero of decimal points and eligibility. Avoiding error dispensing refers to minimizing mistake or errors in various processes, especially in tasks that involve providing or dispensing information, products, or service. It involves implementing measures and best practice to prevent errors, improve accuracy, and enhance overall quality. And this is example of common dispense error.
For example, look-alike, sound-alike is Cardiprin, Cardiprin, C-A-R-T-I-P-I-N, Cardiprin, C-O-R-D-I-P-I-N, Cardiprin. Second is Zental and Zontac. For Zental is Z-E-N-T-E-L and Zontac is Z-O-N-T-A-C. Third is Covax and Novax. C-O-V-A-S-C, Covax, and N-O-R-V-A-S-C, Novax.
Now we move to height alert medication, HAM. Height alert medication are medication that bear a heightened risk of causing significant patient harm when these medications are used in error. Common risk factors associated with height alert medication are as follows. Number 1, poorly written medication order. Number 2, incorrect dilution procedure. Number 3, confusion between IM, IV, intrathecal, epidural preparation. Number 4, confusion between different strains of the same medication. Number 5, ambiguous labeling on concentration and total volume of medication. Number 6, wrong infusion rate. Number 7, look alike or sound alike product and similar packaging.
Today, I want to present about other strategies. For example, drug protocols and standard order forms. Guide the safe use of medication by eliminating problem with illegible handwriting and standardizing safe order communication. Nevertheless, there may be times when this is the most appropriate and only tool available to remedy a medication use problem. Besides that, technology and education, automation and computerization of medication use processes and tasks can lessen human fallibility by limiting reliance on memory. Example include use of technologically and clinically sound computerized drug information system, direct physician order entry which provide drug information and warning during order input, and use of IV infusion pumps with forceps design mechanism to prevent free flow. Education and information. Staff education can be an important error prevention strategy when combined with other strategies that strengthen the medication use system. That's all from me.
Okay, now role of pharmacists and PA. Participate during therapy monitoring and due activities. Next, stay abreast with current state of knowledge. Third, be available to offer information and advice. Fourth, familiarize with medication ordering system and drug distribution policies and procedure established for the organizational setting. Moreover, dispense medication in ready-to-administer dosage form whenever possible. Moreover, the unit dose system is strongly recommended as the preferred method of drug distribution. Lastly, review the use of auxiliary labels and use the labels prudently when it is clear that such use may prevent errors. For example, check well for external use only and not for injection. That's all from me. Thank you.